With every preventable medical error, there's still no patient and family's voices to be shared. Our voices are still being lost. We need to hear these stories so other patients and their families can become educated, advocates, and participants in their medical treatment and avoid these unnecessary deaths and, of course, many more injuries that occur. We're working to not only improve the outcome in care, but also the communication, the relations, and the respect between the patient, family, and provider. For many of us, it's too late to help the ones who are closest to us and who have suffered. But there's no doubt we will continue to use the healthcare system.
My mother, Joan Farrington, went to the store for laundry detergent. She turned onto the main street and her car was hit by a speeding van. The emergency room resident diagnosed broken ribs and a pelvic bone fracture. My mother called me herself, and I came to see her, and I spoke to the doctor. He said she would take time to heal, but should be able to go home in a couple of days. My mom worked in this very same emergency room as a registered nurse. As a physician myself, I was on call and had to be available to work on Tuesday. I was tired on Wednesday, so the next time I saw Mom was Thursday evening. That Friday morning, the dreaded complication, a massive pulmonary embolism, caused cardiorespiratory failure, and my lively, loving mother died in the intensive care unit within 24 hours. I called the New York State Department of Health sometime later. They investigated and found many errors and substandard care during the hospital course, many more than I had observed. This is a complex problem. There are systems errors, there are errors of individuals, both on the part of the patients and providers of care. The vast majority of providers are very caring and hardworking on behalf of their patients and would never intentionally harm them. But fatigue, time pressure, poor communication cause provider errors or contribute to provider errors. The question for this evening is how to get the best possible outcome with the currently available services. We must all educate ourselves and our loved ones. We must advocate for ourselves and our loved ones. We must put in the time to observe the caregivers and the setting in which we find ourselves. We must speak up if something doesn't seem right. We must become activists for change at the level of the individual encounter, whether it be in the doctor's office, the emergency room, or at the bedside in a nursing home or a hospital.
Today's Times editorial says, "Wounded warriors, empty promises." I don't know if you read that. The Iraqi soldiers are not getting cared for in our hospitals. Very sad. Neil, my husband, was unable to talk, had righted himself on the bed, but when he could not answer my questions, I knew it was a stroke. Every minute someone in the United States has a stroke. That means more than 700,000 people each year. And I took that from a book called My Stroke of Luck by Kirk Douglas. The EMS staff, ambulance, and police arrived. When I was asked what medication he was on, I ran to the shelf in the bathroom. They were not there, and I couldn't say what he was on. And the course that Eileen gives and Leslie gives, they make a point. If you put your medication list on the refrigerator, it's very handy so everybody knows what's happening there. Wow, okay, so lesson learned there. I realize now how much you remember of what you see when you're in a hospital. You're busy doing this, but you're recording an enormous amount of information on the sideline. The aloneness, isolation, fear, and inability to find someone to answer questions is part of the family member's trauma. Appropriate communication helps prevent trauma to the family. I was absolutely astounded at the social workers I met giving pitying stares and no information. And I know that's not good social work. So from all of the things that we go through, we're looking to find a better way to do things.
When I tell people that my daughter Catherine had open heart surgery at 6 weeks old, they often say how sorry they feel for her and how scary the surgery must have been. Catherine's surgery was scary, but it was life-saving surgery, and it could not have happened soon enough. For 6 weeks, our daughter waited for her surgery, while the doctors and hospital staff misdiagnosed her, tested her with spinal taps and catheterizations, x-rays and scans. She was poked and prodded while they treated her for reflux and not her heart condition. Our daughter was born with 2 holes in her heart, a treatable condition. Instead of transferring my daughter to a qualified pediatric cardiology facility, under their care, my daughter deteriorated. She became severely emaciated, in severe congestive heart failure, with an enlarged heart. She struggled to breathe with every ounce of energy she had. Our concerns about Catherine's condition were always dismissed. She slept all the time and was unable to drink her bottles because it took so much energy. Her cradle would rock back and forth just from the breathing of her heart. She began to lose weight instead of gaining it. Then one night, while Catherine was in ICU waiting for her operation, we were asked if they can do an arterial line. We were concerned about the wording of the consent form, but we were told the cardiologist wanted it and that she would need it for surgery, and it would alleviate the need for them to keep probing her veins, since they now have to go in her head. If it could somehow ease our daughter's pain and suffering, we agreed. They said it would only take 30 minutes. Over an hour went by, and they still were not done. I knew something was wrong. I knew my daughter was in the room dying. He continued to say they were going to try something else. We said absolutely not. We told him we wanted our daughter out of this hospital right now, and we wanted to see the cardiologist. Our daughter was dying. When the cardiologist came to see us, he was sweating and nervous. He began to try and calm us down. My husband and I continued to tell him we wanted our daughter out of this hospital, and we wanted her operation done tonight. Our daughter was not waiting anymore. The cardiologist called the surgeon. He would be available to do her operation. Almost immediately, her condition improved. She was treated with dignity and like a human being. My husband and I saved her life by demanding she be transferred. We found that her heart was working so hard it was as if she had been running a marathon 24 hours a day, that she never had reflux, that she never would have waited so long to have her surgery, that all the symptoms she had been displaying were due to her heart's condition. It's been 7 years since this happened to Catherine, and for 7 years I've been telling her story. Since Catherine's ordeal, 3 other families have come forward with their story of escaping the failed heart program with their babies' lives. My daughter had a right to be transferred to a more qualified facility. She had a right to be given the proper care. She had a right to be treated with dignity and not used for the doctors and hospitals' financial gain. Catherine also has the right to see that what happened to her does not happen to anyone else, that the agencies put in place by the state of New York will find these doctors and hospitals accountable for the lack of care they provided and acknowledge that what was done to my daughter and to the 3 other families was wrong. We all have similar stories, and we have a strong bond, having gone through what no parent or newborn baby should have to ever endure. That is trying desperately to get your child the help and care they need, only to be misled, mistreated, dismissed, and let down by the very system that is put in place to protect them.